retinol over the age of 40.
Hi, my name is Dr. Xavier, or Dr. X for short. Welcome to my channel. In this channel, we're going to talk about longevity medicine, anti-aging medicine, aesthetic medicine, hormone therapy, supplements, nutrition, anything to do with anti-aging and healthy aging. So welcome to my channel and enjoy today's video. Let's talk about retinol. What is retinol? Why do we need retinol? What is the difference between retinol, retinal, or tretinoin? Why do we need these ingredients? Hi, welcome to today's video. And today I want to really talk about tretinoin, retinol, and any derivatives which we refer to as retinoids. Retinoids are really important when it comes to anti-aging for skincare. And it is important to know what happens to us as we age. So once you get to over 35, definitely over 40, your skin does not behave in the same way as it did when you were 18, 20, 25. The cells in your skin that make collagen slow down. Those cells are called fibroblasts. Now, fibroblasts sit in a layer of the skin which is called the dermis. That's kind of the middle layer of your skin. And they slow down, so they're not making collagen. The same cells, the fibroblasts, also create elastin and hyaluronic acid inside the dermis. So as we age, we have less active fibroblasts, therefore less collagen, less elastin, less hyaluronic acid. So what does that mean for us? It means that our skin is going to be a little bit drier, especially in ladies, but also not as plump, not as hydrated from inside, less collagen, so less support, but also less elasticity. So the skin recoil is not as great as it was when you were in your 20s, in your prime. So what can we do? We can use a lot of different skincare ingredients, and I do go through a lot of different skincare ingredients in my videos. But today I really want to focus on retinoids. So a lot of people use products like retinol, but they don't really know why they should be using them. And what is then the difference between retinol, retinal, or tretinoin? So it is important to talk about that. The effect of retinoids on the skin is profound because retinoids can actually penetrate through all the skin layers, but not only into the cells, but also into the nucleus of each cell. Why is that? Because each cell in your body contains a nucleus. So your skin cells also contain nuclei. So the cells in your epidermis contain nuclei, except the very top layer, which is called the stratum corneum, where the cells are basically dead and have no nucleus. But from that layer downward, all the cells contain a nucleus, including any cells in your dermis. So that would be your fibroblasts, that would be all your blood vessels, even the fat cells underneath the skin in the subcutaneous layer, they contain nuclei. On each nucleus, there are receptors that can attach to retinoids, and they directly take the retinoids inside the nucleus of the cell. So retinoids have a very profound effect on the skin because they actually alter the DNA of your cells and then make your cells behave in a different way. In what way? In a younger way. So you actually start having cells in your skin that are being younger, are growing better, in better quality, and they're functioning much better as well. So in terms of what it does into your skin, well, let's have a look at our little skin model. So this is what I made earlier. So we've got the different layers of the skin here. So we have our layers of the epidermis, we have the dermis, and we have the subcutaneous fat with all the blood vessels. So what retinoids are going to do, first of all, is they're going to speed up the turnover of the epidermis, which is very important because you really want to have fresh cells coming to the surface all the time. So your skin looks soft, luminous, and you remove the pigmentation or sun damage that is accumulated on the surface of the skin. Retinoids will also affect the fibroblasts, of course. They make them produce a lot more collagen, a lot more elastin, more hyaluronic acid. So that's fantastic. That's a very, very good anti-aging ingredient to have. And retinoids will also improve the blood circulation in the skin. So you get more oxygen, more nutrients into the skin. They also reduce the oil, or excess oil I should say, in your skin. So if you've got a little bit of oily skin, or maybe you're acne prone, retinoids are fantastic for that as well. And also retinoids will have a direct effect on reducing excess pigment production in the skin as well. So it's really good that we have retinoids, but we just need to be a little bit careful with retinoids because they can create a bit of irritation initially. So when you start using a retinoid, first of all, you only use it at night time. You only use a tiny little pea-sized over the whole face. Use your fingertips to apply it to the face, not the palm of your hand, because you'll be wasting a lot of the product on the hands. Apply it to the face. Don't mix it with moisturizers because you really need to use the product as it is, unless instructed by your practitioner to mix it with specific products. Otherwise, do not dilute it with a moisturizer. And apply it at night time. And make sure you wash your hands afterwards. You do not want to touch any body areas, including your neck, when you've just put a retinoid on your face, because it can be quite irritating. Start maybe 2-3 times a week at night time and just build it up. So you can start very low in percentage, increase the percentage, and also gradually increase the frequency to gradually allow your skin to get used to it, because retinoids can cause irritation, including flaking, dryness, and redness. But we can explain that when we look at what retinoids do to the skin. Obviously, they increase the turnover of the epidermal cells, which means your skin initially will flake because all the dead cells are coming off. Once you get into that and you've increased the turnover of your cells, that flaking, of course, will stop. It will not carry on. And the initial redness is of course because you have more nutrients and oxygen coming through the skin because the blood flow has been increased in the skin. So that initial irritation that we get using retinoids is completely normal. It can last anywhere between 4 to 12 weeks for it to really settle down. So persistence is the key. You need to be persistent, use it as guided by your practitioner, and make absolutely sure that you use a sunscreen during the day, because they can make your skin a little bit irritated and therefore more susceptible to sun damage. Just please bear in mind, if you are pregnant or breastfeeding, you should never use a retinoid on your face. Absolutely never. So make sure you stop as soon as you know you are pregnant, or if you're planning to become pregnant, just do not use any retinoids. So what is now the difference between retinoids in general or retinol and tretinoin? So retinoids refers to the general name of the family of these products. Within that family, we've got different molecules. So we've got retinol, retinal, retinaldehyde, tretinoin, and so on and so on. So tretinoin is retinoic acid, which is the prescription strength, the strongest retinoid available to us, which is a prescription medicine prescribed by a prescriber, which could be a doctor or a nurse or any practitioner that is qualified to prescribe. Tretinoin in itself comes in different percentages. Most people would start at 0.025%, and then you can gradually go up to 0.1%, which is the highest strength. Then you have other ones such as retinol and retinal. These are weaker because once you apply these products onto the skin, they need to be converted into tretinoin or retinoic acid into the skin before they can penetrate the cells and the nuclei of the cells. So therefore, if you want to start gently, of course, you can maybe start with the retinol, see how you get on with that, and then gradually increase the percentage, gradually increase the frequency, and then ask your practitioner maybe to then move you on to tretinoin, and then gradually increase the percentage and the frequency. So you may say, well, why do I need to go through all that hassle of redness, flaking, and irritation and use this product? It's because it is the only product that has scientifically 100% been proven to be anti-aging. So from all the skincare products out there, Tretinoin, retinoic acid, is the one substance that we know for 100% that it will create collagen in the skin, and that has been proven by biopsies from the skin where we can physically see more collagen being built in the skin. So if you're interested in anti-aging skincare, or you want to keep your skin in top condition and reduce sun damage, I would strongly recommend that you use a retinoid, perhaps retinol or tretinoin, as part of your skincare routine. Just make sure that you discuss that with a practitioner to make sure that you stay very safe using this product. So if you like this video, please subscribe to my channel and don't be afraid to ask me any questions. I would be more than happy to reply and engage with you and have a chat about anything anti-aging. Thank you for watching.